Wednesday, everyone out there watching today's Hearts for Home Care Advocate Training. We are going to get some updates on what's happening on a federal level today from my colleague, Maggie DePasquale. Before we get to that, some housekeeping items. So, we do not like to start these shows without giving away some swag. The newest giveaway, this nice Hearts for Home Care water bottle. So the first trivia question, how many members in the U.S. House are there? First one to comment in the chat is going to be our winner. All right, second one is the easier one, but it's as fast as you can get it in there. How many members of the U.S. Senate? Don't get this one wrong. All right, so because we can't have the same winner for both, we have two winners already. Congratulations. So Blake Ross hit the first, and Joaquim Santos the second. So if you could email advocacy@heartsforhomecare.com with your address, we will ship those out immediately. All right, now to bigger and better things. So Hearts for Home Care Advocacy is a group of individuals all in the support of home care on behalf of clients, field staff, and loved ones, wanting to make the home care ecosystem a better place for everyone. We know it's the preferred choice, and what we try to do is advocate to our state and federal legislators on behalf of those who can't. We try to give them a voice and make sure that they are being heard by their state and federal legislators. What we do on our end is make sure you are aware and provide education on these topics and what is happening on a state and federal level. Right now, hot topic comes to my colleague, Maggie DePasquale, federal issues. Maggie is going to go over what is currently happening, where we are jumping in already to advocate and support this, and what is going to be coming up next. So without further ado, I'm going to turn it over to my colleague, Maggie.
Hi, everybody. My name is Maggie Pasquale. I cover federal issues in Hearts for Home Care. I'm so excited to have everybody here today to share some updates about what's been going on this summer. There's a lot of talk in the news about Congress and what they've been working on. So I'm really excited to share that, and then we can touch base about some advocacy efforts and do some Q&A at the end if you have any questions at all. So I will share my screen so we can discuss these first. All right, so our first topic we're going to discuss today is the One Big Beautiful Bill. This is some legislation that passed at the end of June, early July. It took up a lot of airtime in the news. I'm sure if you were watching the news during that time, you heard a lot about this, and it does impact home health care providers and recipients. So it's definitely something that we want to discuss. There was a lot of changes, a lot of things that were taken in, put out, back and forth as it went through the legislative process. So we're going to take some time to discuss what was in the final version and therefore was passed into law. So the first thing that impacts our clients, our providers, our concerned advocates would be the Medicaid work requirements. This was included in the final bill, and it mandates that able-bodied adults aged 19 to 64 without dependent children or disabilities must work, volunteer, or attend school for at least 80 hours per month to maintain Medicaid eligibility, or you must earn an income greater than the federal minimum wage for 80 hours, which is $580. Now, there are some exceptions in this bill for people who are pregnant, for parents with dependent children 14 years old and younger, and for those who are medically frail, disabled, caring for individuals that are medically frail or disabled as well. So those people will not have to meet these work requirements. This goes into effect December 31st of 2026. So there is a little bit of time before these will go into effect and start impacting us. Now, as a result of this going into effect, there is going to be a burden about who is going to confirm eligibility. There's going to be a requirement that either you or the state or somebody's going to have to make sure that you are meeting these requirements in order to keep your Medicaid eligibility up to date. So that is really concerning to us. There's already so much that goes into determining Medicaid eligibility. This is another area that people are going to have to address while they are receiving their care. The next part is a few different portions that impact the FMAP percentages and the federal FMAP. Now, to take it back a little bit, the FMAP is the federal portion of money that the government gives to states to go into their Medicaid program. So Medicaid is actually funded partially by the federal government and partially by the state government. Included in the One Big Beautiful Bill, there were several changes to the FMAP. The first is a reduction to FMAP for states covering certain immigrants. So states that provide emergency health care coverage for undocumented immigrants would see their FMAP reduced from the expanded 90% to the state's traditional FMAP percentage for emergency services. These are services that would be provided most likely in an ER in order to stabilize somebody who would walk in. And this would go into effect on October 1st of 2026. Next is the sunset of the enhanced FMAP for expansion states. The temporary 5% enhanced FMAP that states who were newly expanded Medicaid after the Affordable Care Act, this would be sunset. So that's no longer available to those states, and this goes into effect on January 1st of 2026. And then finally, the prohibition on federal funding for unverified status. So federal Medicaid and CHIP funding would be prohibited from individuals who self-attest U.S. citizenship or qualifying immigration status that cannot be verified. And it makes state coverage for those individuals optional during this period. And that also goes into effect on October 1st of 2026. This impacts home health care and our Medicaid recipients because anytime you are reducing a state's budget, especially a state's Medicaid budget, that's definitely going to have a trickle-down effect and an impact. You are reducing the overall pot of money, so states are going to have to adjust within this area. We are already seeing some adjustments taking place, not directly correlated, but indirectly correlated in North Carolina and Colorado. So we are starting to feel these constraints going into effect. Up next is the Medicaid redetermination eligibility and cost sharing. These were also included in the final bill. So this provision requires states to conduct eligibility redeterminations at least every 6 months for Medicaid expansion adults. There was an amendment originally introduced that would have removed and excluded disabled populations. However, that did not make it into the final bill. This will go into effect for all renewals scheduled after or on December 31st of 2026. This is going to have an impact because, once again, somebody's going to have to make sure that they are eligible, or the provider will have to make sure they're eligible. The process is going to vary by state, so it's hard to see how this will impact each person individually, but it is going to have a burden of making sure that people are meeting these requirements and are up to date every 6 months. Then we also have the copay requirement. There is a requirement that states impose cost sharing, also known as copays, up to $35 for service for expansion adults with incomes 100 or 135 or 38% of the federal poverty level, and this goes into effect on October 1st of 2028. And this is a financial impact to Medicaid beneficiaries depending on the cost or service provided. So this is still something that states will have to figure out, but it's going to impact our populations and our concerned advocates as well. So that is what is impacting us in the One Big Beautiful Bill. There's going to be a few years of transition, a few years of working things out, of states coming up with their processes for verification and working through these requirements, but we are expecting to see some of these impacts start to trickle down even before they hit the states. And up next, we have a Medicare issue. It is the calendar year 2026 Home Health Proposed Rule. Earlier this summer, the Centers for Medicaid and Medicare Services released their proposed rule for the Medicare home health services. Included in the proposed rule is a cut to the overall reimbursement of Medicare home health, by 9%, resulting in a 6.4% cut overall. This impacts the industry as a reduction in the funding going through this service by $1.135 billion for just 2025 alone. So this is really concerning for us because that is a huge number for just 1 year. Anytime there is a reduction in reimbursement, it is going to create access to care issues. Now, CMS is required to have a comment period where they solicit feedback from stakeholders and concerned individuals. Those were due by August 29th, so last Friday. And the last time I checked, they have over 5,000 comments already submitted. So that's 5,000 concerned individuals, groups, parties, different people who are really concerned about this. And that was only updated on August 14th. So there's still probably thousands of more that CMS has yet to post on there. We are expecting the final rule to be published in October, November time period, and that will have the final cut. We are hopeful that CMS will hear our concerns. There was a lot of discussion about flawed methodology, about where these cuts are coming from. People are concerned about the math that they are using to come up with these calculations. So I'm hopeful that they will have some adjustments in the final rule that we will see. So that is what's coming down the pike. I will stop sharing. Mike, do we have any questions in the chat so far? Anything?
So far, so good. Everybody is on board. Just a couple looking for the content, and we will share that through the YouTube channel of the Hearts for Home Care Advocacy, the entire recording.
Yeah, absolutely. So then there's some question about what can we do about this? What is something that we can do? So the first opportunity is next week, the National Alliance for Care at Home is having their national fly-in. They're having a whole fly-in week surrounding this, a whole advocacy week. So if you are interested in being part of that and sharing your voice, I definitely recommend you go to the National Alliance for Care at Home website, which we can send out after, and share your voice, get involved. They have action alerts, they have all different things that are going to be surrounding this week to make sure that all concerned members of the home healthcare industry are able to share their voice. There's also an opportunity if you would like to meet with your legislators. We have plenty of resources on the Hearts for Home Care website. This is a great time to really share the direct impact that it has on you. Congress is back in session. They're back from their August recess. They are looking for feedback. So it's really a good time to share your voice. And these issues do have a large impact on individuals at home. It's not just policy. It really is. It comes down to how this is going to affect people's lives. So we would love if you would share your voice, if you would join us on the Hill next week. But I really appreciate everyone's interest in this. And if you have any questions about federal advocacy, if you would like to get involved, please let me know. It's always a great time to advocate.
All right, Maggie, I have two questions. One, how can someone join in the Alliance fly-in?
Yes, so you are able to register on the Alliance's website. We can send the link out to join in, and then they will have a list of dates and activities and all the different things that we can do. It will be in Washington, D.C. in person. However, there's always opportunities to advocate virtually as well, but we can send that link around and get people involved.
All right, and do you know who within CMS proposed this reduction?
So CMS is more of a unified voice. They do this as they have authorities within their body that do the calculations. They have a bunch of different people who come up with these recommendations altogether. There's a lot of research that goes into it. But originally the recommendations come out of MedPAC, which is a nonpartisan, unbiased research arm for CMS. And they are the ones who make the recommendations to CMS, and CMS can either follow them or they can make their own based on their own data. CMS went a little bit above and beyond this year. MedPAC originally recommended a 7% cut. CMS is recommending a 9% cut overall, which reduces down to a 6.4% cut due to some different line items in there. However, they don't have one person within CMS. It's more of part of their whole administration.
Okay, I don't see any others. If you do have a question, you want to put it in? If not,
Melissa said, how do I join? We'll send out all the links for everyone as well.
And if you need to get in touch with us, the easiest way, advocacy at heartsforhomecare.com, and one of our team members, whoever it relates to, will get back to you as soon as possible with your question. You can always visit the website for a lot of the detailed information, and the Alliance fly-in, as Maggie said. You can actually go to their site too and learn more about all the activities that will happen next week.
Thank you so much, everybody. I look forward to advocating with you.
Thank you, everybody. Thanks for joining. Send us any questions you have, and have a great day.
Bye.